Welcome to this enlightenment about your health. I am Dr. Ezano White-Debere, an optometrist. Today, we are going to be looking at a very important topic, glaucoma. As we all know, the month of March, precisely from the 8th day of March to 14th day of March, has been mapped by World Glaucoma Association in partnership with the International Agency for the Prevention of Blindness, including the World Health Organization, as World Glaucoma Week. This year's World Glaucoma Week has been made to be Beat Invisible Glaucoma, that's BIG in acronym. What is glaucoma? Glaucoma is a group of eye disease that affects the optic nerve. What we mean by optic nerve, the optic nerve is more like an information giver to the brain. When the optic nerves are being affected, glaucoma tends to set in. Causes of glaucoma. There have been implicated many causes of glaucoma worldwide, but before we delve into different types of glaucoma, it has been uncovered that about 3.54% of the prevalence rate of glaucoma has affected the world population. In 2013, it was estimated that 64.3 million people worldwide has glaucoma, and that number has been projected to increase to 74.0 million in 2020. And the most important aspect of this, why we are creating this awareness, is that by the year 2040, about 111.8 million people of the world population from the age 40 to 80 are likely going to have glaucoma. Glaucoma can be caused by many factors. Three important tissues, or will I say the three important parts of the eye that help for us to understand everything that has to do with glaucoma. Number one is what we call the trabecular meshwork. The trabecular meshwork is more like the center whereby the sieving of the fluid of the eye takes place. Number two, we have the ciliary body. The ciliary body is the seat of aqueous humor production. Aqueous humor is the fluid that helps to give shape and helps to help the eye for it to be the way it ought to be. Then number three, we also have the angle of the anterior chamber. The angle of the anterior chamber helps in the circulation of the aqueous humor around the eye. Then, causes of glaucoma. There are two major causes that has been uncovered in healthcare profession that brings about glaucoma. Number one, there is what we call the pupillary block, and then there is what we call the clogging of the trabecular meshwork. Then, types of glaucoma. One, we have the open angle glaucoma, which accounts for 90% of the entire glaucoma that is being suffered by the world population. Number two, we have the angle closure glaucoma, otherwise known as the closed angle glaucoma. Three, we have childhood glaucoma, and many more. But our concern in this video is to talk about the open angle and the closed angle glaucoma. Open angle glaucoma, as we all know, account for the 90% of the entire population that has glaucoma worldwide. Why this glaucoma is termed open angle is that the trabecular meshwork, which is responsible for sieving the aqueous humor that circulates the eye, is being clogged, while the angle where the fluid passes through is normal. In open angle, the clogging of the trabecular meshwork tends to bring about the aqueous humor not circulating the way it ought to circulate, thereby affecting the optic nerves. The optic nerves, which sends information to the brain when the pressure of the eye increases, will now become deteriorating and dies off. This open angle glaucoma comes without any signs or symptoms, but the peripheral visual field are being affected first. Number two, the angle closure glaucoma. In angle closure glaucoma, there tends to be pushing of the iris towards the cornea, and when this occurs, the angle in which the aqueous humor or the fluid, the intraocular fluid that flows in the eye, tends to pass around the eye is being closed. So when the closure occurs, it tends to bring about the increase in pressure of the eye. What are the symptoms of glaucoma? As the first type of glaucoma I mentioned, the open angle glaucoma accounts for 90% of all the entire cases of glaucoma worldwide. And in the symptoms that are present in open angle glaucoma, usually is symptomless because 90% of the world population suffers from this type of glaucoma. but the individual tends to start noticing the blurriness of his or her peripheral vision, meaning that in open angle glaucoma, the peripheral visions first of all are being affected. But other than this, there are no major presenting symptoms that tends to occur in open angle glaucoma, which is caused by the clogging of the trabecular meshwork. Then in angle closure glaucoma, about 10% of cases of glaucoma are being seen in angle closure glaucoma. There are presenting symptoms which makes angle closure glaucoma to be recognized as what we call a medical emergency. Number one, there tends to be severe eye pain. Number two, there tends to be severe headache. Then the patient comes down with what we call halos around light. Number four, the person tends to be feeling nausea or the urge for the person to vomit. Then we also notice that in angle closure glaucoma, there tends to be blurriness of vision. In angle closure glaucoma, there is pushing of the iris towards the cornea because the seat of production of aqueous humor exists between the cornea and the iris. But when the cornea is being pushed, or when the iris is being pushed close to the cornea, there tends to be blockage or clogging or reduction of the angle. What are the risk factors of glaucoma? The major risk factors of glaucoma is in Black American. It has been observed that the Black Americans are 5 times of higher risk when they have ocular hypertension in coming down with glaucoma. Number 2 is when there is family history of glaucoma. That's one of the risk factors. Number 3, if an individual have a centrally thin cornea. Number 4, aging is also a risk factor, as we know that from the age of 40 to 80, the diagnosis of glaucoma tends to have increased over time. Another one is when an individual is of high myopic or high hypermetropic section. Then number 5, or the other, is when there is trauma in the past, probably when an individual has trauma and nothing was done about that. Diagnosis: how do we diagnose glaucoma? Diagnosis of glaucoma actually is what is being done by an practitioner or a healthcare professional who have been certified to treat problems of the eye, like your optometrist and your ophthalmologist. The diagnoses are being made with different instrumentation by your optometrist, with the use of number 1, your ophthalmoscope. The optometrist can also make with what we call the visual field analyzer. Okay, we also have the gonioscope, which helps to check the angle of the eye to know whether it is normal, to allow the circulation of intraocular fluid around the eye. And there are other things that can be done in order for the diagnosis of glaucoma to be made. So it's been advised for you to visit your eye care practitioner who is in the right position with the right instrumentation for diagnosis of glaucoma to be made. How do we manage glaucoma? In the management of glaucoma, there are many factors that are being considered. So treatment of glaucoma or management of glaucoma is the sole work of an eye care practitioner. We can make use of what we call different types of eye drop. We have the alpha agonist, we have the beta blockers, and many others that can help in minimizing the way the intraocular pressure tends to affect the eye. If there are cases in which there is increase in intraocular pressure, there can also be co-opted of what we call the carbonic anhydrase inhibitors, which also helps in the management of glaucoma. Number 2, the use of antioxidants or capsules or tablets can also help in the management of glaucoma. But one thing you must know, that in management of glaucoma, your eye care practitioner has already known the right step to be taken. So even when the symptoms are not presenting and you are predisposed pertaining to what your family history says, glaucoma can be managed. How do we prevent glaucoma? There is a popular saying that prevention is better than cure. Number 1, going for a comprehensive eye examination is one of the key for you to prevent glaucoma. Secondly, knowing the family history or your family history, whether anybody in the past has glaucoma, can go a long way preventing you from having glaucoma. Number 3 is having regular body exercise, because there has been some literatures that have supported doing exercise daily can help in regulating the way fluids flows around the eye. Number 4, even if you have been diagnosed to have glaucoma, or even if you have been diagnosed to have risk factors that predispose you to glaucoma, using your eye drop constantly can help you to limit the intraocular pressure increase or the ocular hypertension from becoming glaucomatous or predisposing you from having glaucoma later in the future. So in management of glaucoma, or in prevention of glaucoma, or in making glaucoma not to be a burden to you, I suggest that you visit a nearest eye hospital or eye clinic and have your eye holistically checked and have your eye holistically managed if glaucoma has set in, and surely you are going to have a long way to go in terms of using your eyesight. Thank you very much.